And if I may introduce our next speaker, who is Gianfranco Di Vanna, who is our field specialist and expert in basically setting up contrast transecho, contrast echoes in general. Gianfranco has got over 20 years experience with Sonoview in the field, developed experience as a contrast expert and trainer in many countries around the world, Europe, Asia, and Latin America. He is training customers on contrast usage, image optimization, and system settings. Gianfranco was kind enough to bring in his expertise and teach us on how to improve contrast examinations, giving us some tips and tricks how to better optimize settings, technicalities, and practicalities. Gianfranco, looking forward to your talk.
So I'm going to show you a collection of common tips that I have accumulated during my visits to customers and during the OEM trainings. These are recommendations that you can follow to improve your contrast examinations. And it's not only for beginners, but also whoever has experience with contrast. So first of all, let's talk about what is Sonoview? How's the bubble? The bubble, Sonoview bubble is a phospholipid shell embracing an inert gas. The phospholipid shell is flexible, and that will give you the enhancement, the brightness that you see, while the gas, which is the sulfur hexafluoride, will give you the stability in time. So that is the effect that you get with the low MI. Low MI will create this oscillation in the bubbles. They will compress and expand very nicely. And that is crucial for the machine to detect where the blood flow is. So if you see in this image, let me just get the laser pointer so you can see it. The probe will send a wave that will touch the bubbles and will create that oscillation. Then those bubbles will send back to the probe a different wave. So the machine is trained to identify that kind of signal. And that's why the machine will eliminate the tissue and other information. That's why when you go to contrast mode, everything is dark and you will not see brightness until you see the bubbles arriving. So between 0.1 and 0.3 is the range, what is called nonlinear response. And that is the oscillation we saw before. This is the MI. And obviously, if you see that if you go over 0.3, you will start compressing the bubbles until they break. But this is the clue. This is the good moment where the machine will identify the bubbles. Another thing very important, Sonoview is a blood pool agent. So the Sonoview will remain confined to the vascular space. It does not go through the interstitial spaces. So it remains in the blood and keeps circulating until its elimination. Its elimination is the gas gets expelled by the lungs and the phospholipids metabolites mainly in the liver. So in about 15 minutes, everything is gone. So let's talk about the preparation, which is one of the critical things that I see in the field. The first preparation, the Sonoview kit comes with everything you need. So once you combine it, then you inject the saline, then you will have to shake for 20 seconds. Those 20 seconds mean that the saline gets combined with the phospholipids and the gas gets integrated into the bubbles. But it is very important to do it and then leave the vial on the table. Do not keep shaking because you will increase the temperature. Do not keep it in your hand because of the same reason. Remember, it's lipids, so they will behave differently. And only when the machine is ready, this is something that I normally recommend, only when the machine is ready and waiting for the contrast, then you can ask the nurse to inject, and then she will pick up the vial again from the table, shake for 5 seconds, and then inject immediately. Extract and inject immediately. If you always do that, you will always have the highest concentration of bubbles. So what happens when you shake? You create a high concentration of bubbles. You will create up to 500 million microbubbles per milliliter. But then the concentration will decay You can see that on the imaging because there's different factors influencing this. One is the MI, which is the energy, the preparation, the way you were shaking, the administration, if there's tubings or anything in the way before the vein, and also there's an elimination rate from the body. So all those factors will more or less decay or reduce some of the concentration you see on the imaging. Sorry. So, as I said, when you do the shaking, you will create up to 500 million microbubbles. Those are a lot of bubbles, but you need them all. Different sizes, and this is very important. The majority of bubbles will be around 2.5 micron. That's very small. And then, most importantly, stability after reconstitution, after you prepare it, it's 6 hours. 6 hours at room temperature. Sonovu is designed to be at room temperature. That's why I said just leave it in the table, and then whenever you need it, just pick it up. Remember, there's a gas inside here. It's not air. In the phospholipids, there's only one way to integrate the gas into the bubbles, and it's by shaking. Let's talk about settings, optimizations. So, what are the factors influencing a good contrast imaging? The MI, obviously, it's energy, the gain. You will learn about that in a moment. The focus position, the injection rate, especially in cardiology, you need to be careful about the injection rate. The condition of the machine will also influence sometimes the probe and things like that. And then, most importantly, the shaking. The mixing is crucial for a good and strong enhancement. I always recommend to shake before you extract and then inject immediately. Do not leave the sonogy in the syringe because it's not going to be as good as you want. And especially do not inject the sonovu when it's transparent. That means there's no gas in the bubbles. So it's the agitation guarantees a homogeneous concentration. There's many, as I said before, there's many different bubble sizes, and you need them all. And the higher the variety of bubbles, the best the enhancement will be. Let's talk about the more technicalities, system settings, more or less. So there's three: the mechanical index, the focus, and the gain. Mechanical index is transmitted power, so it will destroy the bubbles if you increase it too much. Gain will not destroy the bubbles because it's amplification, returning signal, the one I showed you at the beginning. And same as TGC. TGC stands for time gain compensation. You can see that on the right. Normally, the recommendation, most of the times, is to leave the TGCs more or less in the center, except for the first two or three, because you don't want to have a brightness on top on the superficial part of the imaging. And then just increase or decrease the gain with the knob on the machine. That allows you to have a very homogeneous enhancement. Okay. Normally in LBO, you see an MI of 0.3. That is quite high, but remember in the chart, it is still low. It's still within the range of low MI. This is done because you want to have a big difference between the myocardium. So the bubbles get compressed completely and then disappear from the myocardium against the cavity. And that allows you to do wall motion or abnormalities, ejection fraction calculations, and everything else. Furthermore, the focus. Focus normally should be put at the valves. That's because you want to have homogeneous enhancement all along the cavity. On the opposite side, when you have, for example, when you want to focus your attention on the apex, then you can move the focus up to the apex, and then you will have very good resolution on top and very ugly resolution below that, because your attention is to the focus, to the apex, I'm sorry. So remember that bubbles get touched by the wave and reflect back. But sometimes it happens that the enhancement is not as bright as it should be, especially in cardiology. Make sure that you align the probe, put the angle of the probe to be incident to the cavity. So you get all the bubbles reflecting that signal back to you, back to the probe. So keep the probe aligned as much as you can. The injection. Slow in cardiology. This is important. If you don't do it, you will not have a good enhancement, or you will have some effects that I will show you in a moment. This is just an example, 1 milliliter, 3-4 seconds. And then saline, the same, more or less the same amount or a little more, and then slowly. That's because if you don't do it, you will have a high concentration of bubbles in the apex, and it will give you some shadowing. That is very common for me in the field to see because, especially for saline, saline is a stressor for the bubbles because you're pushing everything in a different volume. So just make sure that you do it very slowly on both, on the contrast and the saline. If you need extra help, Bracco offers free visits upon request. The format is you will have an application specialist like me with you all day while you scan your contrast patients. We will assist you on everything related to the contrast examination, from preparation, mixing, injecting, bubble trainings, principles for the entire team. That's a good idea. So the entire team gets educated. Teach you the best contrast settings. So you have those settings, those principles will be good for you for the future. So you do a very good contrast examination. And then obviously guidelines on how to improve and how to keep a good enhancement on contrast ultrasound. At the end of this webinar, you will have a survey that comes automatically. If you want anybody from Bracco, somebody from Bracco to contact you, just please leave your contact details, and you will get a contact from them. I have finished my presentation. Thank you so much.
Thank you very much, Gianfranco, for this very practical and useful tips and tricks of how to use ultrasonic contrast agent in the cardiac setting. I'm sure that there will be some questions to you as well at the end of the talks.